Hi, this is Kelly from RVA Holistic PT, and I wanted to just drop in and talk to you guys about cesarean scar healing. A lot of times my postpartum moms tell me that they weren't told to do any cesarean scar massage, or maybe just in the postpartum haze they forget the details, but it is a good idea to mobilize your scar. If you had a scar anywhere else on your body and you say like a knee surgery, you would go to physical therapy and we would teach you how to get that scar moving. And that's how cesarean scars should be handled as well. So when you think about your belly, you've got the layers of the skin, and then you've got fat layers, fascia or connections, like cotton candy like connections that go through the whole body. Then you have the muscle layers, several muscle layers, and then you get into the organs like the bladder and the uterus. You want all those layers to slide and glide on top of each other. And sometimes women have a cesarean and they have no problems like with those layers kind of sliding, gliding, and they have no issue at all. But in 6 to 18% of women, they'll have chronic cesarean scar pain. And that can be solved in a variety of ways, but one of them is through scar massage. So to massage your scar, you want to, when it's fully healed, for sure by 6 weeks, you want to be starting to do massage. So if you pretend that this is a scar, then you're going to move it in all directions. Left, right, up, down, circles, other circles, throughout the whole length of the scar. If you find a very sticky part of it, you can concentrate more energy there. You want to feel like you're doing something, but you don't want to feel like it's painful, certainly no wincing or nothing intense. But you should feel like you're kind of, you do some light stuff where you're kind of on the beginning layers, and then some deeper where you're on the deeper layers. Another thing that I find when scars are pretty persnickety and like really are having a hard time with those adhesions and those stuckness is sometimes I'll use cups and do cupping on the scar. So to do that, you just use lotion and you basically use your cup, you create a little bit of suction. This should be tolerable, it shouldn't be extra painful, and you can move the cup along the length of the scar. If you find any sticky parts, you can kind of focus a little bit more energy on those sticky parts, and you can even do a little pulling. So whereas the massage, you're pressing down and you're getting the layers to loosen up by pressing down, the cupping does the kind of the opposite thing. It pulls up. So this pulls up and you can give it a little extra traction. So it's just different. They're both very useful. And I find sometimes when patients have a hard time tolerating one, they'll tolerate the other. But the gist of it is you want to help the layers slide and glide, because as we move our body, even moving your arm, those layers at your belly, in the cesarean area, they have to slide and glide. And if you have adhesions or stuckness at your bladder or your uterus, it can create pain. It can create problems with your peeing, can create problems with pain with sex, and sometimes it'll create just pain at the cesarean scar when you're not even moving or doing anything. And it certainly can also affect your muscles and your core strength if all those layers are stuck.